Hi, my name's Bernice and I'm one of the infant feeding leads here at North Cumbria Integrated Care Trust. I'm here today to do one of our infant feeding bite-sized videos for you, and this one's on hand expressing. So when might you hand express? All mums can harvest their colostrum antenatally from 37 weeks onwards. This could be during induction of labour, prior to a planned caesarean section, or once baby has arrived. Why might you hand express? So it's a great skill to have, but practice makes perfect. Hand expressing helps stimulate milk production. Having hand expressed colostrum or breast milk can help tempt a sleepy baby to feed. Colostrum or breast milk is like a medicine for sick and preterm babies, so you may wish to express if your baby is on the neonatal unit. Hand expressing can help mums to soften their breasts by removing a little bit of milk if they've become full. Hand expressing can help mums to self-manage blocked ducts and can help prevent and reduce symptoms of mastitis. By having hand expressed colostrum or milk, you can provide an alternative to giving baby a supplement of formula if baby is not feeding effectively. Hand expressing can help you return to work or study. And if you choose to formula feed, you could think about hand expressing and still giving baby breast milk, as every drop really does count. So how do you hand express? The first things first, clean warm hands, and you'll need a sterile container handy. So this could be a syringe out of your colostrum harvesting pack available from your community midwife, or it could be a sterilised bottle. The next thing is try and relax. I know it's easier said than done, but it really is important. If you're doing this antenatally after 37 weeks, you could think about baby. Look at a scan picture, rub or stroke your bump, or even talk to your bump. Imagine your baby being close to you. If your baby has arrived, ideally have baby close to you, maybe in skin to skin. Smell baby's head. If you are separated from your baby, smell something they have worn. Look at pictures of them. The next thing is massage. Massage is important because it helps stimulate oxytocin release, and nipple stimulation helps stimulate prolactin release, two of the really important hormones. Now, this usually happens in the background without you even being aware. And it is important to note that if you're antenatal and you don't see any colostrum when you're hand expressing, not to worry, because everything you're still doing is important. You're still sending signals to your brain, you're still taking practice, and practice makes perfect, and you're still becoming familiar with your breasts. So on to massage. I'm going to use my knitted breast as an example. Now, this should never be painful. You should never do it too hard. It should be enjoyable. And what you can do is it right up into your armpit, because you actually have ducts and breast massage up there too. So do this for a few minutes. If you're preterm, you may need to massage for a little bit longer. So I'm going to start off with some firm circles. And what you're doing is it all the way around the breast. You could then do some firm strokes down towards the nipple, some nipple stimulation, some kneads, and some taps. So after massage, we're going to go on to the hand expressing. So you'll need to make a C shape with your hand, a bit like if you were holding a glass. Can you see that C shape with my finger and thumb? Exactly the same C shape on the breast. So cupping the breast with that finger and thumb in a C shape. And what you'll need to do is to move 2 to 3 centimetres back from the base of the nipple. And what we're trying to do is we're trying to find your right spot. Now, your right spot and my right spot will be in different areas because we're different shapes and sizes. But the rule of thumb is 2 to 3 centimetres back. And you might feel a change in texture from the nipple area to that 2 to 3 centimetres back. Now, if you feel that you need to move a little bit further forward, then do, or a little bit further back. Okay, so once you feel that you've got that right spot, you need to compress and release. And what you can see me doing is it in a rhythmical pattern. So we're not gliding towards the nipple or sliding or rolling or squeezing anywhere near the nipple. With that 2 to 3 centimetres back in that C shape, compressing and releasing. Now, after a few minutes, if you've done this and you're not seeing any beads of milk or colostrum, then change position to be a bit further forward or a bit further back to again find that right spot. When you've been doing this for a little while and you've got your rhythm up, you will then see some beads or droplets on your nipple, and we're going to collect those. I'm going to use my syringe as an example. Comes with a nib, so take the nib off and you can collect it like so. Some people find that it's easier to take this purple bit out, put the nib on like so, and collect the milk into a bigger hole. And then after you've finished, putting that back in. But whichever way works for you, as long as it's sterile, you can collect it whichever way you find best. So imagine your breast as an orange inside with segments. What we're trying to do is we're basically trying to remove milk from all the segments. So once you've got milk and it's started to slow or stop from this area, we're going to move round and we're going to compress and release and collect the milk in this area. And again, once we've done that area and it's started to slow and or even stop, we're going to move round again, getting all that milk out of those segments. Now, when you've been all the way around the breast, move on to the next breast. You'll have to start off with massage. And again, remember your principles of C shape with your hand, your finger and your thumb, and cupping the breast 2 to 3 centimeters back in your right spot, compressing and releasing in that rhythm. Now, it's important to note in the early days, we're talking about colostrum, we're talking about drops and beads. If you want further information about why colostrum is in such little amounts purposefully and how it's like liquid gold, please do watch our newborn baby infant feeding bite-sized video. If you're day 2 to 5, usually around day 3, we're expecting probably squirts, which is when your milk starts to come in. But it's important to know antelatally or in the first few days, we're not expecting large volumes. So what's next? If you are antenatal, you can express into the same syringe over the course of the day and after every expression session. And then at the end of the day, store that syringe in your freezer. Now, in your colostrum harvesting pack is some labels. So we'll need you to fill those labels in with details like your name, your date of birth, and when you've harvested the colostrum. And then you can actually bring those syringes into hospital with you when you come to have your baby. We do advise only small amounts and leave the rest at home. And you will need to bring it in frozen, so in a insulated bag with some freezer blocks. And because it's such small amounts, it does defrost quickly, and we don't want to have to get rid of any of your harvested colostrum and your really hard work and your liquid gold. So please do transport it carefully. If you are postnatal and you're doing this postnatally on the postnatal ward, then we will support you to store your breast milk. If you are at home, we would advise you to safely store your breast milk with the guidelines from the Breastfeeding Network, which are available on the webpage, which I will post on the next slide. But usually in your fridge for around 5 days at the right temperature and around 6 months at the right temperature. So, like I said, some further reading and some really important resources for you is the Breastfeeding Network expressing and storing breast milk there at the bottom. But also support groups are available on your Badgernet app. You can go to them antenatally or when baby arrives either. Also, the breastfeeding or hand expressing video by the Baby Friendly Initiative UNICEF is a really good one to watch as well. If you need any further information or support, please don't hesitate to contact your community midwife, or myself and Andrea are available for any specialist infant feeding support, may it be required. Thank you for watching.